Phaco in small pupil with no pupil expanding device, tips and tricks. We have no financial interest. The surgery demonstrated herein is done by an experienced surgeon keeping ready all necessary backup instruments, IOL and equipment. Surgeons believe that the safety of the patient's eye is of paramount importance. Usually, pupil expander devices are used while doing phacoemulsification in small pupil, but if the cataract is not very hard, we can manage the case without using pupil expander as demonstrated in the following cases. Case 1. At the starting of the case, pupil is 3 mm in diameter. Maximum pupillary dilation is achieved by viscomydriasis. 5 mm diameter capsular excess is made following pupillary margin. Hydrodissection is done and it is ensured that the nucleus is freely mobile. This is an unedited video of phacoemulsification. The size of the incision should be adequate so that there is no fluid leakage during phacoemulsification. The nucleus is divided into two halves and chopped into multiple fragments. Phaco probe is kept at the center and the second hand is used to rotate the nucleus. Newer generation phaco machines have good control and better followability to get quadrants aspirated and emulsified. Bimanual irrigation and aspiration is done, and before aspirating, always check that anterior capsular margin is not caught. IOL is implanted in bag under visco. Thorough visco wash is done using bimanual. Side port and main port are hydrated. Case 2. Capsule is stained by trypan blue dye. Capsular excess is done along pupillary margin and in some places 1 to 2 mm larger than pupillary margin. Multi-point hydrodissection is done. It is ensured that the nucleus is freely mobile. Anterior chamber is filled with viscoelastic. This is an unedited video of phacoemulsification. We have working zone of central 3 to 3.5 mm just below iris plane. Phaco probe should always be kept at the center, and the smaller nuclear fragments are fed to the probe by the chopper. The use of second hand is of importance here. Care should be taken to avoid catching iris with phaco probe. If by any chance iris is caught by phaco probe, it should be released immediately. Bimanual irrigation and aspiration is done. One should always check before aspiration to avoid catching anterior capsular margin or posterior capsule. One should always catch anterior ledge of the cortex sheath. Intraocular lens is successfully implanted in bag under viscoelastic. Viscoelastic is thoroughly washed from anterior chamber by using irrigation and aspiration. Sections are hydrated and anterior chamber is formed. To conclude, phaco is possible by any experienced phaco surgeon without pupil expansion devices unless there is a hard cataract, very shallow anterior chamber, compromised cornea, compromised zonules and fibrous anterior capsule. These are the post-operative pictures of some other cases where we did phaco without using pupil expansion devices and got satisfactory results. Thank you.